What's going on, everybody? This is your man, Dr. John C. Turner, aka the Professor JT, and we are here again with another amazing The Doc Chat show. Now, if you are checking us out, make sure you hit us up in the comments. Let us know what doctor program you are in. Let us know what doctor program you've completed, because I'm telling you right now, I always bring on heavy hitters, and I got some on today. Dr. Janet A. Williams, Dr. Stephanie Wellington, they are here to talk about their amazing doctoral journeys and their incredible businesses. I'm telling you, I got Black women entrepreneurs, and we got to celebrate Black women entrepreneurship always. So, without further ado, I'm going to allow these great doctors to introduce themselves, starting off with Dr. Janet A. Williams. Welcome to the Doc Chat Show. Let everybody know a little bit about yourself.
Hi, Dr. John. My name is Dr. Janet Williams. I have a DNP. I've been a midwife for the last 19 years at a New York City Municipal Hospital in a full scope midwifery practice. And it's been my pleasure and privilege to journey with over 900 mothers and their families to ensure the safety of their babies on their way earthside.
We love it. With 900 women. Wow, that is a blessing. Definitely a blessing.
Yes.
All right, we have Dr. Stephanie Wellington. Welcome to the Doc Chat Show. Let everybody know a little about yourself.
Hi, Dr. John. Thanks so much for having me. I'm Dr. Stephanie Wellington. I am a medical doctor. My career began in New York, going to undergrad, and then I moved on to Ohio State University, where I completed my Doctor of Medicine degree, and then on to pediatric training and neonatal fellowship training. My medical career spans the scope of over 2 decades. And during that time, I also became a certified professional coach and have a business nurturing MDs where I support physicians as they go through their journey.
Absolutely love it. Absolutely love it. Dr. Whitty, we appreciate you tuning in, my God, checking us out here on the Doc Chat Show. Hey, he's got it said, going good. Let's go, great doctors. That's what these women are. Phenomenal, phenomenal doctors. So we're going to jump right into it. Dr. Williams, the DMP, why go for it? And what was the push that pushed you to go get that DMP degree?
Okay, so I had been thinking about the DNP for several years before I actually did it, and it was daunting for several reasons. I wanted a DMP, which is a doctorate of midwifery practice, but I was waiting for a school to become accredited. So that put me on hold for a little while. And then my procrastination, a lot of it was my mindset. At the time, you kind of question your ability to complete a rigorous program. You worry about, do you want to start new loans again, new student loans?
Yeah.
And do you want to go into debt for another degree? So the funny story is, a few years later, I was on vacation. And if you want to see me rise up to a challenge, tell me I can't do something. That's all you have to do. Um, I had begun my business and there were so many questions that weren't answered. And so I thought that entering a doctoral degree would answer some of them as well as surround me with like-minded people. So I was on vacation in San Diego with my husband and I was sitting on the balcony and checking my email. And an ad came up for a university which we will remain unnamed. um, Basically asking for sharing the information about their doctoral program, that DNP program. And it had a small area to fill out. And so I filled out the inquiry and I hit send and sent it back. Within 20 minutes, my phone rang and I was on a recorded line with a gentleman who asked me many questions. And in the end, he offered me admission. He offered information about his Master's of Nursing program. And I told him I'm not interested in a nursing master's. I already have a master's in midwifery. I would like to know more about the DNP. Well, this gentleman told me that I didn't meet criteria and that I wasn't eligible. But again, he said, I'll be happy to sign you up for the MSN program, the nursing program. I basically told him, you don't know what you're talking about. You need to send my information to somebody else. And I immediately applied to another school the same day. So about a week later, he was blowing up my phone, leaving messages, and I finally called him back. And he told me He's been trying to get in touch with me all week with great news. You've been accepted to our doctoral program. I informed him I was no longer interested. I had already enrolled in another program. And since we were on a recorded line, I stated that he needed to be more careful about what he said to people because he could have derailed someone's dream. And if I
Yeah.
had been a student who gave up easily, I may never have tried again. And I added that he hadn't been very nice on his first call. So that's basically how I started my doctoral process.
Hey, hey, everybody has a story. That's the truth. And Dr. Wellington, what is your story? What made you go for that MD? Because I'm telling you, a black woman MD, that is impressive.
That is.
Thank you, thank you. Early in my youth, had a family relative who had a diagnosis, but really wasn't guided along their path for treatment. And so I began to realize that, we needed more people who were going to be invested in us in terms of our healthcare. And so when I was in high school and did that biology class, I fell in love with biology. And that's really what made me determined to become a physician. In undergrad, we all go in with the lofty dream of becoming the doctor. And I met many people who we were all going pre-med together. But undergrad is very difficult terrain to navigate to get there
Yeah.
because there's
Yeah.
so many classes that you need to have. And then there are ones that, get you there, but get you there on a much longer path. And I knew I had 4 years of undergrad and 4 years of medical school. So I really had to become my own advocate. And, you go to your advisor and like us, your advisor is not as invested in getting you there. So all I
That's right.
needed was that paper that told me these are the classes that you needed to take to pass the MCAT. And I made sure that I integrated them into that 4-year program so that when it was time to take the MCATs, I had the core information that I needed. And unfortunately, there were people who, went along the journey with me, but never got there because they didn't have the same information, not even advice, but information. Because once we have information, we can use that information to get us where we want to go. And so that was my journey in the first half of it. And then upon getting into medical school, again, knowing what you need to know and then what are the steps that you need to take to accomplish it. And sometimes we do have to understand that we don't walk this journey alone and
Yeah.
that we need to have support systems in place.
There you go.
So, where I went to medical school, we ended up having a lot of the opportunity to have support groups, to be in the SNMA, the Student National Medical Association, which really helped to support us getting through the 4 years of medical school onto graduation.
And that's phenomenal. We have Dr. Williams, Dr. Wellington here on the Doc Chat Show. And my guy, Dr. Williams, is right about Dr. Williams. She was not having it. You're not going to derail her dream. It was not happening today. We love it. We absolutely love it. So, Dr. Williams, you finally are in that program. In the program you had been wanting to get into. How was it the first year? And what were some of the things that were like, oh man, maybe I don't know about this. Maybe this ain't it.
The first year was hard, and I think part of that was getting back into the study routine because I had been out for quite a few years. And the other part, I think, was I went in with a project in mind when I started my doctoral progress there. I was very interested as a midwife in adolescents. And what I had noticed as a clinician was when I started talking to my young ladies about birth control, or if I said the word contraception, it was like a veil went over their eyes. They could have been so animated a second before. And as soon as I mentioned those words, it's like they just blinked out. And I said, I have to find a way to get that veil down so that they hear me. Because I don't think that it's almost like they just went absent on you. So my project that I wanted to do involved adolescent females and talking about sex and contraception, which is almost a no-no because, those are things that people really don't want to talk about. And so the first year in talking, I had an advisor and I had really good professors that said, whatever your topic's going to be, if you already know what it is, you should work towards that the whole time that you're here. When you're doing different papers, when you're doing different assignments, gear it towards your topic, so that way when you get to the lit review, you've done a lot of the work already. So I started that way, but a lot of my classmates, what I found, they were kind of, I'll say, almost coerced into changing their topics. And they did not, because people were saying this is too hard, this is too broad. And instead of helping them narrow it down where they were still on their topic, a lot of them were kind of encouraged to change their whole topics, which is wrong. Because you're going to be with this for the whole time you're in school. So you have to do something that you really care about.
That's true. That's
Yeah.
And Dr. Wellington,
Mm-hmm.
now you're in medical school. The dream has come true.
The dream has
Tell
come
me how
true.
that dream was that first year.
The dream was a nightmare the first year. And I'll say that because how you study in undergrad is not what's going to get you through medical school. You know that saying, what got you there cannot carry you to the next place.
You're there.
Yeah.
And the volume of material that you have to master in medical school is what you had to do for an entire 4 months, 5 months in undergrad is one section in medical school. And so it is all consuming, and you really don't have the skill set to study the way you need to study for medical school. And so you have to learn how to manage the material. And so, that first semester, actually, when I went home for Christmas break, I said to my parents, if I don't pass, I'm not going back. And I meant it. And it was just, and I think also, so I went to Ohio State. My family and my home base was in New York. And so here I was in a totally new Columbus, Ohio, in a totally new city, really didn't know anyone. And I thought that was the thing to do because I said, I will be able to concentrate. I'll be able to focus. I don't have any distractions. But the reality is I also didn't have my support.
Right.
And so that really, hindsight's 2020, maybe, or maybe it wouldn't have made a difference. But when you get into that hole and the overwhelm sets in and the anxiety sets in, and you just don't really know where to go. Yeah. And there's, as much as we want to believe that we're all collegial, there is a level of competition that exists, right? There are rank lists that come out and everyone wants to be at the top. And so you really have to find those people who are going to support you, both your classmates as well as faculty who are willing to support you. And I was lucky enough to have faculty who, when I found myself struggling, they literally were like, I'm going to help you. And we met and I learned the study skills that I needed in order to continue on.
That's beautiful. That's beautiful. And trust and believe, me being from Indianapolis, Indiana, and knowing great folks like yourselves from the New York area, when y'all come to the Midwest, it's like, what is going on?
Like, it is very different.
We are here, folks, on the Doc Chat, Dr. Wellington and Dr. Williams. Now let's go to those final years, Dr. Williams. What was your project on, and what were some of the, okay, I think I got this moments, and what were some of those like, oh my goodness, what have I got myself into?
Okay, so my project was it was called Dreams Matter, Future Goal Setting and Contraceptive Intent in Adolescent Females. And it addressed a problem facing adolescent girls with the innovation. What I did is try to set up an innovational education program that introduced what I call life planning. Instead of contraception, I called it life planning, education, and career motivation. And I thought that had the potential to make a significant impact in their lives. So what I did is I found an iPad-based app on an iPad that explained about contraception. And it had a young person that talked about it that was actually on the contraception, plus a provider that talked about it. Also, there was a career motivational component over a 4-week period. And they took a questionnaire before and after to measure that how much contraceptive intent they had. And I think that especially for different careers, if they don't see different careers and if they're not exposed to it, how do they ever even choose? How do they know how to dream if they've never seen it? So that's where Dreams Matter comes in. The program I used had over 500 different careers that they could plug into and hear about. Um, it's called Career Girls. It's a app. It's a website that's online, and anybody can get it. It's free. It's a beautiful program. I just fell in love with it when I was doing my research, and it exposes them and hopefully causes a spark that gets them excited about their future. Once you show them the future, now you can talk to them about how to get to that future. And that is what my project was about. I didn't mention the fact that I did enroll in Wilkes University from in Pennsylvania.
Okay. Okay. Wonderful. Wonderful. And Dr. Wellington, now you're at that finish line. What was kind of your final work? And you did a residency, correct? Is that kind of was your next step?
Yeah, so
Okay.
we moved from in the classroom to clinicals. Again, you know, clinicals has its own challenges in that it's Columbus, Ohio. So I see less people that look like me on the rotations, the competition that exists there. But you forge ahead and you I recommitted every day to what my goal was, and figure out, okay, you know, where am I going to do residency? And for me, it was a decision between adult medicine and pediatrics, and I took the pediatric route and then moved on. I matched at NYU in New York and relocated back to New York.
Nice.
And the challenges in residency are the hours. Again, the competition, you know, we are moving hopefully to a kind of friendlier place. But in medicine, the competition is very real and the hierarchy is very real and the long hours are very real. And so having to every day re-encourage yourself and believe in yourself
Yeah.
and be able to, you know, be on a rotation where there's a pecking order that exists. And so, you know, you're kind of, you know, show up for the attendings and answer their questions, but knowing that there's a senior resident, there's a junior resident, and you're the intern, and the lowly intern has to have the fortitude to get through that internship. And unfortunately, what sometimes happens is the same pecking order that existed for you when you're an intern, when you move up through the ranks in the hierarchy of medicine, you just continue. Some people just continue to do the same thing to the new interns and to the medical students. And so that's the challenge in medicine, because it really makes you question, are you good enough? Right? And that whole being not good enough syndrome. So the challenge is really keep going, connecting to your purpose, connecting to your patients. For me, I went into neonatology and I loved the newborns and I really loved working with the families. And though they're in very vulnerable positions, having a baby who's very sick, being able to make that connection with the moms and the dads, that's what carried me through a career of more than 2 decades.
Wow, that's incredible. Absolutely love it. Love it. Hey, folks, I'm telling you, these doctors are coming with it today. They talk about the real of getting these doctor degrees. That's why we have the Doc Chat Show. So, Dr. Williams, tell me about the day, the graduation day, knowing you were done, knowing you got that final project approved. How was it?
That final project was approved finally. My classmates were almost finished their whole project, and I had not gotten my IRB done yet. Again, because of the fact that I was dealing with adolescents, because the fact that I was trying to do it without parental consent. It was Title 10 in New York, where in my office, a 17-year-old could walk in my office, a 16-year-old, and they didn't need parental consent to come in my office and talk to me. Okay. If that was going to block a lot of the young people from participating or talking to a provider about contraception. So I was trying to do it with Title 10 in place. But that was really hard getting through the IRB. And again, they kept trying to change the age of my study. They kept saying, put it up to 17. 15 is too young. And I was like, no, this is the age I need. And I just was very steadfast, and I just stuck to that, because I think that that was the age of the kids needed to start hearing this early. Not at 17, it's kind of late to hear about a career if you've already finished high school. You know what I'm saying? They needed to hear it when they still had time to do some things, to go into certain careers. So I stuck to it. I finally got it approved. We did it with consent at the end. They finally were going to approve it without consent. But then Career Girls had a little clause in small print that said they needed parental consent to be on that site. So in the end, we got it. But it I finished my project. I met some phenomenal people along the way. It was an online program, so we never met in person. Everything was online. And the day of graduation, we finally met each other in Pennsylvania. It was awesome. It really was. We celebrated at that point.
That's amazing. Definitely amazing. And Dr. Wellington, finishing
Mhm.
up, what was it like? And even today, what does it feel like knowing that you had that dream come true?
When I think about being a doctor, and actually not just being a physician, but so many things that have shown up in my life as a result of it, I know that it was my calling and it was my purpose. There is no doubt in my mind. So I reference, for example, a few years back, right before COVID, one of my favorite uncles was diagnosed with cancer overseas in another country, in the islands. And I was able to take time off and be part of his palliative care team.
Wow.
And that probably was one of the most difficult things that I had to do. But that most difficult thing that I had to do was the right and perfect trajectory for my life, and just blew my mind in terms of when I look at how did I never knew back when I made the decision to become a doctor and when I graduated undergrad in medical school that would bring me to this experience.
Yeah.
So it just anchored that yes, this was what I was meant to do. This is what I was supposed to do. And having that experience with him has allowed me to come back into medicine. I took about maybe a little bit over a year off, but it allowed
Okay.
me to come back into medicine, seeing patients and be even more committed to making sure that, my patients are babies, so their parents, they understand what is happening with their babies. They
Yeah.
understand, it's not just the baby's been here for 2 days, 48 hours or 3 days or longer. And, we give them a piece of paper and says, this was a hospital course and this was a discharge summary. Take it to your pediatrician. But you understand, you are able to ask questions. You're able to access information on the internet and be able to interpret what is appropriate for you and what can you discard, and be able to formulate questions based on that information that you get. So it was really the confirmation that yes, this was the path that I was meant to be on.
That's awesome. That's amazing. Dr. Williams, they're tuning in to you. I'm telling you. Dr. Woody said that's what you call owning your study. That's what you did. She said, we are doing 15. That's what we're going to do. And I
We
love
do
it.
it.
And our good friend, Dr. Richard, our Doc Chat Show doctor, said meeting that cohort at the hoodie is quite a treat. And we know that it is. And she's from the islands herself. I'm telling you, she is loving the show right now because there's great doctors on here and great doctors are doing great things. Shout out to everybody tuning in. Let us know you're tuning in. These great doctors, Dr. Williams, Dr. Wellington, here on the Doc Chat Show. And I am excited that we're about to check out the work that they're doing, these great businesses
Mm-hmm.
that they have. So let me start with Dr. Williams here. Let me get you pulled up. All right. Tell us all about Transitions Women's Health Counseling LLC.
Okay. So I started Transitions Women's Health Consulting, and my mission is to enhance women's reproductive health through professional integrity, education, and advocacy. And the vision is to ensure that all women have access to respectful, culturally sensitive care. And I want to play a role in decreasing maternal mortality and morbidity in women of color, especially through provider education and to better actualize culturally competent care. And one thing we need to do is increase the number of people going into careers in birth work, especially, I'll say, women of color or people of color.
Now, how many people's lives you already say have been touched by this business? Because this looks incredible. Just the work that you're doing and what's being done.
I think it's touching a lot of lives. Just I'm just becoming social media savvy, a little bit savvy now. I'm on social media and interacting with a lot of healthcare professionals. I'm seeing how we're all working towards decreasing maternal mortality and seeing that people are working in silos all over the country trying to fix this problem. And in talking to people, what I'm finding is that we see that there's a multitude of problems that's causing maternal mortality and morbidity. And in 2022, the CDC basically came out and said that at least 80% of the women that are dying, it was not necessary. It shouldn't have happened. Okay, so there are reasons
Wow.
why, why women are dying, Black women are dying. And we need to sit down and we need to talk about it. But I'm finding that a lot of people don't want to, um, they don't want to or don't understand how bias plays into this, how systemic and structural racism plays into this. And those are things that need to be talked about. So that's what I talk about in my business. I talk to other health professionals. I talk to medical students. I talk to midwifery students. Anybody that'll listen, we talk about it. And it's something that you have to do self-assessment because people will say, I'm not biased. And what I try to tell people is we are all biased. So when I'm a speaker, when I go out and speak to different organizations and groups, I tell my story first. And then that way they see I'm not pointing fingers at just them. It's pointing fingers at both of us. My mother used to say, when you point your finger, one finger is pointing at somebody else and your thumb is pointing at you. So we have to all do self-assessment and see what bias is and then check ourselves out because at board reports all over the country, you'll hear biased things being said every day and people don't even recognize that that's what's happening.
Wow. We got a good Dr. Jones tuning in. He's a great businessman as well. We appreciate you over there in Philly at Villanova. We appreciate you. And Dr. Woods, I have to ask because it's all in the news right now. And you brought it up. Why don't women want to talk about the mortality rates when it comes to pregnancy and what's happening right now? Why is the conversation so to speak, taboo that we just don't want to talk about?
Well, it's coming out now because it's more publicized in the news. It's just been kind of a quiet thing under the surface, but it needs to be brought out. Unfortunately, a lot of people don't want to talk about it because they feel like it's going to scare women and, you know, and take the joy out of pregnancy. And what I think as a midwife is that we have to do a lot of education with our women. We have to teach them to advocate for themselves. We have to teach their families and partners to advocate for them. They need to have other support systems. They need to have doulas. Doulas are something that I love, doulas, because they're there. That's her person. That's who's going to be there to advocate for her and the partner. So it's a lot of education on both sides, on the side of the client and on the side of medical professionals.
So, with this opportunity, being on this show, what would you tell pregnant women right now, especially pregnant women of color, Black mothers to be? What would you tell them?
I would tell Black mothers or mothers to be that they need to find a provider that they're comfortable with. There are different types of providers. You have doctors, you have midwives, okay? Um, you have support systems. You have people that are doulas. Like I said, they're there to support you. They're non-medical, but they're there to support you. So they should have a choice of who they choose as their provider. Unfortunately, we don't have the numbers of midwives and doulas yet out there to accommodate everyone, but that's the thing about trying to get people involved in birth work and interested in it, so more people would go into that career. But the women and birthing people need to find a provider that listens to them, that they feel comfortable with, that will answer their questions and listen to them when they have questions or concerns.
That's, that's amazing. Now, is that something that you do, or are there ways that individuals can get in touch with these people? Like, where would they look? I think that's always usually a question.
Mhm.
Individuals like, well, I need to go to a doctor, but I can't find a doctor. Or where would people look for these certain types of individuals, doulas and midwives and different things like that?
They could go online to their they can go online to their insurance company to see who they have in their system as far as midwives. Doulas are starting to be paid by certain insurances. It's not across the country yet, but it's coming. Um, and there is a directory which I can't tell you off the top of my head. I will think about it before the end of the show. That is providers of color. It's an online
Mhm.
directory where they can actually go in and see, in different areas where you have providers of color. So that's one way to do it.
Thank you. That's awesome because
Mhm.
that's what we need. We need those solutions, and we
Yeah.
have people that can bring those solutions. So people can't say, "I just didn't know." There are
Mhm.
opportunities. There's people out there to help you. There's solutions for you. So I actually love it. Absolutely love it. Make sure we get Dr. Whitty here. Hey, he ain't lying right here. It's actually research we need more of, Dr. Whitty, and you all are doing a great work, and we appreciate that.
Mhm.
Once again, we're here on the Doc Chat Show with Dr. Williams, Dr. Wellington, and we have not one but two amazing businesswomen here. So we're going to go into the great business, Dr. Wellington, and nurturing MDs. Let me get this pulled on my other screen here. All right. Tell us about this incredible work that you're doing, Dr. Will.
So as I mentioned, probably after the first third of my career, I became a certified professional coach. And one of the reasons why I decided to do that was to merge and find another way to, one, take care of myself, but also take care of my patients in medicine. When you're working with high acuity patients and large volumes of patients who are very vulnerable, who are on the cusp of life and death, taking care of babies who are 24 and 26 and 28 weeks, and death is always present there. There is a need to do more than just the intubations and the umbilical lines and the therapies. There's also that humanistic, that holistic part of all of us that gets impacted when we're working like that. And so I found coaching as an avenue to bring in new principles and new ideas to support myself as well as the families that I'm taking care of. And out of that has grown taking care of or supporting physicians in similar situations. If you look in the social media realm with medical professionals, there is this move to exit. What's my exit strategy? What's the next thing that I'm going to be doing and leaving medicine? And so at Nurturing MDs has grown to support the physician who is staying in medicine, because one, we all can't exit medicine. Who's going to take care of our patients? But we also need to be taken care of.
Yeah.
And as we take care of patients in the clinics, in ERs, in on the floors, and in units, we are subjected to our own wounds and micro abrasions that we never heal. Right? A patient dies, and we move on to the next patient. We give a patient just difficult news, diagnoses with poor prognosis, and we move on to the next patient.
Yeah.
And crying, being able to, after a patient dies, being able to just have a moment to cry and express how you feel, that's something that's been taboo. And I think COVID helped us begin to realize that physicians are on the front lines, really, with managing life and death all the time, and we don't have the support systems. And so there's a big shift in conversation about physician well-being now, and what does that mean, and how do we put things in place in order to support ourselves so that we can have longevity in medicine. And so Nurturing MDs is my suite of work, doing both trainings as well as one-on-one coaching with physicians to put in place. I teach the 5 pillars of physician success. And that's, starts with having an abundant and prosperous mindset and knowing that any and everything is possible for you. And that moves on into your life calling. And, is medicine your life calling? Are you doing this for the right reasons? Have your reasons changed and shifted? And where do you need to change and shift in order to adapt to the new person that you are in medicine? Having a spiritual base and a spiritual awareness, knowing that you are never alone. Because so often when we're in those critical places, taking care of very sick patients or giving patients, disturbing news, there's a connection that we've had with that patient. And so often we take on the energy of the doom and gloom when we get to be able to understand that there is a higher calling. There's a spiritual base that exists here that we become a vehicle through which, but we're not kind of the bad person or the messenger giving this information. Developing relationships, networks, family relationships as key and core to your experience and your survival even. So many physicians that I work with, they're doing this alone. Yes, they have family, but they don't want to bring home the traumas from the hospital to their family. And I completely understand that. I know that's one of the things that I struggled with, but using the relationships at home to boost you up, to shift your energy, to nourish you. So that's very important. And so that's basically the work that I do with physicians. I've spoken at different conferences. I've even gone to Dubai and spoke. And out of that, actually, my family's from Barbados. So out of that, I do trainings in Barbados also with their nurses who are, definitely everyone's been overworked and in very trying times during this COVID. And so I've had the opportunity to go there as well and do trainings as they continue to expand their support systems for their teams as well.
Shout out to Barbados. Barbados in the building. I really love it. We love it. Now, tell us about something that you touched on a little bit deeper.
Mm-hmm.
The fact that you're seeing, especially in these last 2-3 years, doctors in the profession, even nurses that have just reached the brink to the point you had some sadly that were taking their own lives.
Yes.
The people that were there to save lives because they were so stressed out. So if you were talking to that doctor right now, that medical person, what are some things they can do to make sure they're taking care of themselves? Because too many times we talk about this, getting to the doctorate finish line, but not enough times do we talk about taking care of yourself after you get done and when you get in your career. This is phenomenal knowledge. It really is.
So one of the things that I think we do is stay in silence. We do, it's I would almost say it's almost taboo to talk about it.
Yeah.
So, early in my career, a patient would die. And, one of the recommendations that was told to me from preceptors and people senior to me was, you have to compartmentalize it. It happened, put it in a box and move on. But the reality is that the trauma that it's caused us still exists. And so you just put something else in the box and put the next experience in the box and the next experience in the box. And in the process, the box is getting larger and larger until it explodes. And unfortunately, you don't have anyone that you can go to talk about it. And, we talk about having mentors and preceptors, but there's, only certain things that we talk about. We might talk about career advancement. We may talk about, what's the next job that we want or the next position that we want or what's the next opportunity. But we don't talk about what is medicine doing to us as people? How are we feeling? And so, when I work with clients, physician clients, that's what we talk about. We talk about how are you feeling? What does this mean to you? Sometimes it's a matter of shifting perspective. The structure of medicine is such that if a patient dies, we have an M&M, morbidity and mortality conference, or we do a case review. And what it often feels like is people pointing fingers. Who did what?
That's right.
Wow.
And unfortunately, that does not help us heal. And so we walk out of those conferences and we feel worse than we ever did. And we don't have anyone to go to, right? They've combed through the chart, they've looked at all the orders, but there's never that place where we get to sit and just say, you know what? This is how death has triggered in me, hurt me. Maybe it's something that's happened in your personal life that it's bringing up. And so it is so important for us to be able to have these conversations us when the trauma happens, because most physicians have not healed from traumas that have happened very early in their careers. And so when we see the next patient, it brings it all back. I'll say for myself personally, I had a traumatic experience in the delivery room. And every time a patient comes in with a similar presentation, that's right there in the back of my head.
Mhm.
And so what I've learned to do though is recognize, okay, it's here. It doesn't have to be this way this time. I acknowledge it. I'm not stuffing it down anymore. And that's what I teach other physicians is we don't have to stuff it down anymore. We don't have to compartmentalize it. What we have to do is bring it to the surface, acknowledge that it's there, ask ourselves, what can we learn from it? And then put those pieces in place. For myself personally, I've also come to the place where I've said, have I done everything that I can possibly do? And so sometimes it means that, in the face of whatever I see in front of me, who is another specialist that I need to call? What's another test that I need to run? Where else can the patient go to get additional, do we need to transfer the patient out to get additional services than what's offered where I'm currently working? And once I've done all those things, then I know I can make peace with whatever the outcome may be. And oftentimes when we are faced with, transferring a patient or calling a consult, sometimes there's barriers there. Sometimes there's the perception of, well, we can do it here. We don't want to lose the patient. There's the politics that comes involved in it. And we have to move past that so that not only are we delivering the best care for the patient, but that we can have peace within ourselves that we've done the best that we can for a patient, recognizing that, yes, there'll be those diagnoses that the patient doesn't want to hear, that we don't want to give, that's going to be traumatic to the patient and their family, but it doesn't make us, it doesn't have to devastate us when we have put those support systems in place for ourselves and know that we're doing the best for our patients.
That's awesome. That's wonderful work. And go back to Dr. Williams real quick, kind of your thoughts on kind of the status of healthcare workers right now. What can be done to help these healthcare professionals, and what can they do to even help themselves in these times?
I think what Dr. Wellington said is right on point. We've worked together, so I know exactly what she's talking about, and it does affect all healthcare workers at this point. But I think that healthcare workers are going outside of the job settings to get help, and that's a good thing. Just like they can go to her for counseling. I teach bias classes about implicit bias. I've sat in numerous classes and conferences that talk about implicit bias. And what I've seen is people walk in, they hear the word bias, they get on their phones, and they basically sign the attendance sheet on the way out to say that they were there. And I think part of that is because they feel that this has nothing to do with me, I'm not biased. But I think that it needs to be presented in a way that they realize nobody's pointing fingers. I'm teaching you what bias is, what does it look like, how do you see it show up at work on your healthcare floor. If you go to grand rounds, if you go to board report, if you hear reports about clients, you hear bias every day, but people don't recognize that that's what it is. And that is exactly what it is a lot of times when you hear reports. And so what I try to do is I try to open it up so that they start to recognize bias and start looking inward. And I did a workbook, and it's a 30-day workbook of self-assessment. And it's basically teaching them about bias and then giving them a place to document every day. And it just takes like 5 minutes to document what came up today for them. Did they witness bias? Was it them or was it someone else? What was the situation? How did it make them feel? Did they say something, speak up, or did they not speak up? And I think that has a lot to do with our mental health also, is that
Mm-hmm.
people see things every day, but they don't know how to speak up. They don't know what to say. Many years I have walked and heard things and did not agree with what I heard, but didn't know what to say. And sometimes you'll hear somebody with like a giggle, and that's just they're so uncomfortable. They don't know what to say, so they giggle. But this education I give is starting to teach them how to actually speak up. And I want to get to medical students and students, professional students, before they ever get out there, because like Stephanie said, that hierarchy of you're the medical student or you're the intern, if it's the intern that recognizes that they just heard a biased remark from their higher up, what can they do? They can't really say anything to them because that's who's grading them.
Mm-hmm.
But they need to have a place to go to be able to unload this, somewhere to talk
Mm-hmm.
about it. So what I try to do is start conversations, where we can talk about this stuff amongst ourselves. And if they can't go to someone at work, at least there could be a support group or someone that they can talk to this about, or how it made them feel, or how do I deal with this? Like, I don't agree with this and this is what I'm seeing, but how do I handle it? So I think that healthcare workers are starting to trying to take care of themselves more. And sometimes they have to go outside of the workplace to do that.
You can open up the gambit right here because wow, the bias. And Dr. Wellington, please talk about that on your end, what you see, because I think that's something especially that keeps, and I'll flat out say it, Black people from even wanting to go to the doctor,
Oh,
period.
Absolutely.
oh yes.
It keeps us not wanting to go to the doctor, and it keeps people not wanting to become doctors because of going back to that whole hierarchy of medicine and the whole, even the training to get there. I've worked with physicians who the messages that they were told during their training, the messages that they were told during medical school has so injured them that as they look to move forward in their careers in medicine, they they're just defeated. They're just
Yeah,
defeated. They just do not. And you're talking about young people who
yeah,
have an entire, are just beginning and are looking to move forward and have, careers of 20 and 30 years. And they're so defeated that oftentimes they give up. Oftentimes they take positions that, will satisfy them so that they have a salary so they can pay off their student loans, but it's not their dream, you know, and that has to be shifted so that you can you get to a place where you don't want to fight all the time.
there you go. Yeah,
Tired, and you can't show up for your patients when you are fighting all the time.
yeah,
And so, it gets to a place where, people complete and can't pass their boards because they just don't have the bandwidth anymore, and they don't have the support systems anymore, and they don't know what else to do. And so it really is very pervasive. And yet, our patients need us. Our patients need people who look like them, who understand their environments that they grow up in, who are not judging them, who are invested in them.
Right.
One of the things that I realized for myself, I often ask myself, why is it that some of the things that happen in medicine and where I practice bother me so much, but I look at my colleagues and it doesn't bother them. And I came to realize that it's because they look like me. And it could be my, when you see families, that could be my brother, sister, cousin,
Exactly.
child.
Exactly.
And so it impacts me. I feel it, and other people, they really don't. And so we definitely need more physicians of color, men and women, willing to and have the supports to carry it through. And it gets very discouraging.
cool. Of course. Wow. We are here, Dr. Williams, Dr. Wellington on the Doc Chat Show, just keeping it real about all of the things happening in healthcare. And now I need some encouragement. Dr. Williams, that person that was just like you, I want to go for a DMP, but I don't know if I can do it. What would you tell that person if you could tell them anything right now?
I would tell them that they should be persistent and resilient, and they should fight if necessary to achieve their dream of higher education and not let anybody talk them out of their goals, dreams, or plans. And surround yourself with like minded people who are challenging yet
Mhm.
supportive, and stretch your imagination. And because this basically, your doctorate is going to stretch your thoughts and your imagination. It's going to put you around people that again are thinking like you, that are going to encourage you, and iron sharpens iron. So going into the DMP program basically expanded my knowledge base because there was nurses from all different specialties there. So it probably was a good thing that I didn't go into the DMP, because that would have been all midwives. We'd all kind of had the same base. But
Mhm.
because I went into a nursing doctorate, I was around nurses that were HIV specialists, CRNAs. You know, those are the certified registered nurse anesthetists. So I was hearing things, that learning from different professionals, and we learned how everything that we do affects our clients at different points, you know. So it didn't matter if they walked into the CRNA's office or if they walked into someone who was an HIV specialist. I taught them about preconception counseling. I said, wherever they hit in the medical system, you can find out what med she's on. Is she planning a pregnancy? Oh, this is, this medication you shouldn't be taking if you're not on a birth control. That could be anybody. It doesn't have to be an OB or a PA or a midwife. Any medical professional should know what meds your client's on. If she's planning to be pregnant, were you pregnant in the last year? Those are questions that is across the board. So what I learned is that no matter where we work, and we understood how important screening was. Like the HIV person was telling us, you need to screen at every visit, questions about domestic violence. I mean, there was so many different inputs that we all just got such a broad and rich education just being together. So I would tell people to go for it. You're going to be blessed by getting your doctorate.
Mhm.
It's hard to get through it, but you have to trust the process and just keep going. And in the end, you'll see that it is a positive, definitely a positive step.
Mhm.
Believe it. Witness. And Dr. Wellington, what would you tell the future MDs?
Honor yourself. So when we get medical students that come in, residents that come in, honor yourself. There's so much that's coming at you, but you have been blessed with gifts and talents that make you uniquely positioned to serve the patients that you are designed to serve. So you don't have to look like someone else. You don't have to practice the way somebody else is. Yes, you have to master medicine, but honor that, because maybe it's the fact that you come from a similar cultural background, or you speak a similar language, or you have a hobby that maybe one of your patients has, or some of the skills that you've learned in your hobby and outside interests help to augment you as a physician. So when we honor that and honor who we are able to navigate this system with all its ups and downs, with all of its pitfalls and peaks. I think it's still a great career to be in service to those the patients that you are meant to serve.
Whether DNP or MD, folks, we need all the black folks we can get in those programs. And I'm
Mm-hmm.
telling you, there are even programs. I've seen a program for McCary Medical School
Mm-hmm.
where they even said if you are a high school senior who is a black male and know
Yes.
you want to do medicine, they'll pay for your whole degree
Right. Full ride.
Yes.
because they need us all so bad,
Yes.
so bad.
And there are other routes that people can take. They're post-bac programs. So if you haven't gotten all the classes that you needed to do during your 4 years in the college, you can do a post-bac program. And then from there, segue on into medical school. So there are a lot of different avenues. So it doesn't have to be the traditional route, but you can absolutely do it.
This is great knowledge. These are great women that are here, and they dropped it today. You see how fast an hour goes by when you're having fun, folks. And we had Dr. Williams and Dr. Wellington. We had an amazing time. So, Dr. Williams, where can folks find you if they want to connect with you, learn about your business and all that you're doing?
They can find me on my website. I'm at www.transitionswomenshealth.net. On it, they can also find my journal. I wrote a journal for postpartum moms. It's a beautiful keepsake for new moms that gently guides them through uncharted territory and reinforces self care. And this journal serves as a quick reference to help decrease maternal morbidity and mortality in the postpartum period. So they can find that on my website also. It's also on Amazon.
Let's make sure we had that up there for the folks. Make sure they see it. Phenomenal, phenomenal resource that you all need to make sure you get. There we go. All right. And Dr. Wellington, where can folks find you?
You can find me at www.nurturingmds.com.
Awesome. That's awesome.
Mm-hmm.
And of course, these ladies are on LinkedIn. That's where I connected with
Mm-hmm.
them with. So Dr. Williams made sure that Dr. Wellington was on with her. You see what happens when these women get together. I'm telling you, they knocked it out the park, and that's what they did tonight. And I just appreciate you both so very much. And if we could have one more final word from Dr. Williams, what's your final word for tonight?
They call me Dr. J, and I believe that babies should go home in their mother's arms. And I give people food for thought in a world full of options. Thank you for having us tonight.
And yourself, Dr. Wellington.
Love life. Live and love life. Thank you so much. It has been a blast. I've totally enjoyed being here and sharing with you and your audience.
New York gonna show up every single time, and that's what they did tonight. We appreciate it very much. Thank you for all the commenters. Thank you for everybody that's tuned in once again. And of course, next week we'll be on the Doc Chat Show with some other great, amazing doctors. And until then, we appreciate everybody. And as we always say, peace out.